Okay, we're in part two. Okay, so here we have Streptococcus pyogenes. It's from the word strepto, of course, in chains, sometimes in pairs. Okay, and the arrangement, again, in chains or sometimes in pairs, and it's a gram-positive bacteria. So you're familiar with the word strep throat, so yung sore throat. So, Streptococcus pyogenes causes yung inflammation of the pharynx, throat, so some soft tissue infection, severe life-threatening infections such as streptococcal toxic shock syndrome, and devastating post-infectious sequela or yung tinatawag nating an after effect of disease or condition or injury, so such as um, rheumatic fever and glomerulonephritis. So sometimes pag meron kayong sore throat uh, na matagal, that Streptococcus pyogenes sometimes can cause rheumatic heart disease also. Okay. Next, we have, yeah, this is Streptococcus pyogenes. So on blood agar plate, uh, it's a hemolytic bacteria. Okay. Next, we have Streptococcus agalactiae. So here, of course, Streptococcus in chains or in pair, and it's a gram-positive. So Streptococcus agalactiae, it kinda colonizes urogenital or lower gastrointestinal tract of healthy women of reproductive age, and sometimes when it goes to bloodstream, it could also cause sepsis. So it's a leading cause of sepsis and meningitis in the neonates or, of course, babies. Okay. So this is the appearance on blood agar. So it's also a hemolytic bacteria. Okay. Okay. So next, so we have here different species of Streptococcus, but take note, Streptococcus are actually Diplococcus. The previous name actually Diplococcus pneumoniae, but later they changed it into Streptococcus pneumoniae. This is the appearance under microscope after gram staining. So among uh, these three, we have Streptococcus pyogenes, which is yeah, they are actually all gram positive cocci, and yeah. Here we have another gram positive cocci like streptococci, but this one is considered friendly bacteria, so it lives normally in our gastrointestinal tract, urinary, and genital system without causing disease. Sometimes yung yogurt drink nyo or probiotic drink, they have Streptococcus thermophilus. And yeah, that's why they produce fermented. They're used to produce fermented dairy foods. Okay, and of course they are also used as dietary supplements, like to increase the level of probiotics. Okay, so this is appearance under microscope. under microscope on sorry. Yeah, this is the appearance under microscope, and of course it look actually when I look at the picture it looked like um rods, but actually it's cocci. Maybe the magnification, due to the magnification. And this is the appearance on blood agar plate. And we have Streptococcus mutans. So this is another strepto cocci, and it's a hemolytic bacteria also, and this is commonly found in oral cavity and of course a significant contributor to tooth decay, Streptococcus mutans. And we have Streptobacillus moniliformis. Okay, so it's a gram-negative streptobacilli. So it could be filamentous or pleomorphic, and take note, don't forget, rat bite fever caused by streptococcus moniliformis. Okay, so yeah, so this is the appearance under a microscope and on blood agar plate. Okay, another thing we have Staphylococcus sapropithecus, Staphylo grape-like, coccus round shape, and common in uncomplicated urinary tract infection. So if you are sexually active, female as well as male, and uh, you develop some inflammation in your urethra. For male, of course, epididymis inflammation or prostate inflammation, and it's bacterial. Maybe it's caused by Staphylococcus sapropithecus. Okay, so this is the appearance on blood agar. It's not hemolytic bacteria. Okay, another one we have Vibrio cholerae. Okay, and of course from the word cholerae and diarrhea, cholera. And the shape, see, it's like a comma shaped bacteria. It's a gram negative, and on blood agar plate, as you can see, it's this strain is a beta hemolytic, but some strain we also have alpha hemolytic. And see, it seems like there is a depression here because of the hemolytic activity of this um, strain. Okay. Of course, we also have Clostridium botulinum. It's a rod shape, and take note this structure, that's the endospore. So it's an endospore forming bacteria, and it's a gram positive rod shape, and of course this bacteria produces the most potent biological toxin called botulinum neurotoxin. Okay, so also used for Botox treatment, the botulinum uh, toxin. Next, we have Pseudomonas aeruginosa. Um, so it's a gram-negative rods under microscope. It appears like this. On blood agar plate, this strain is not hemolytic, okay, non-hemolytic, and Pseudomonas aeruginosa can cause infection in the blood, lungs, pneumonia, and other parts of the body after surgery. So usually just infection.